Hi, I'm Dr. James Machino. You know, high cholesterol is a big problem today, especially with respect to heart attack and stroke and other vascular diseases. In our society, more than 55% of people have cholesterol that's in the undesirable range, the range that increases their risk for heart attack or stroke. Now, the Framingham Heart Study has shown us that more than 90% of people can actually get their cholesterol into the ideal range by just putting into place a solid diet and lifestyle program. That in the majority of cases, people don't actually need drugs to do it. So what is the ideal range? Well, having a blood cholesterol below 150 milligrams per deciliter is the point where almost no one has a heart attack. That's also using millimoles per liter, that would be 3.9 millimoles per liter. And the bad cholesterol, which is known as the LDL cholesterol, should be no higher than 69 milligrams per deciliter or 1.8 millimoles per liter, depending on the units that your doctor is using. Now, the two major problems that I see in the medical management of high cholesterol is the first one, and I see this all the time, where doctors tell people their cholesterol is fine because it hasn't reached a certain critical threshold yet. And so they often wait until the blood cholesterol is above 200 milligrams per deciliter or 5.2 millimoles per liter before they even act on it. Now, the truth is, if you want to get to zero risk for a heart attack, then you need to be under 150 milligrams per deciliter or under 3.9 millimoles per liter, as I said earlier. And that's really where I want you to be. So you have to know your own numbers. Just ask your doctor, what exactly are my numbers, and compare it to the values that I'm telling you about here. The other problem is that doctors, once they see high cholesterol, often put the person onto a statin drug. And the statin drugs are fine when you really need them, but most people can lower their cholesterol without statin drugs. Statin drugs have been shown to do liver damage, kidney damage, and can cause muscle aches and muscle damage in up to 30% of people. The truth is, no one's been taking these statin drugs for 20, 40, 50 years. And that's the idea is if you go on one, your doctor wants you to stay on one for the rest of your life. So let's say you're 30 years old and you go on a statin drug. They want you to be on the drug for 50 years at least. No one's ever done that. So it's a bit of an experiment, and we see that over time there's a chance that liver or kidney damage may actually evolve and become significant. And so if you don't have to use them, I think that really is the best bet. But in fairness, there are people where statin drugs are life-saving. If you already had a heart attack or a stroke, you're in a high-risk category, or you're one of the people with strong genetic predisposition, then those drugs are going to be very valuable to you. But if you haven't had a heart attack or a stroke yet, and you're among the 90% of people where the problem is not really going to catch up with you right away, then what you really need is a prudent lifestyle program. But you have to know what you're doing, because there's a lot of pseudo-experts who really give advice that's inappropriate. And that's where I come in. So I strongly recommend that you download my cholesterol-lowering lifestyle program immediately and act on the strategies that I outline. Now, machinohealth.com, you'll see my published review papers, videos, footage from my live seminars, other downloads, other resources that I know will help you lead a long, healthy, functional life. That's what you want after all. And be sure to review my articles and my teaching materials, because they contain the references to illustrate to you that you're on a sound scientific footing, because all of the scientific references are there. So be sure to use machinohealth.com as an ongoing, reliable resource for both you and your family when it comes to health and wellness issues. Thanks so much for watching.